Students' Competencies Assessment for Evidence-Based Medicine Application.
Good morning. Sorry for disturbance, only I have been thinking about how we can assess our students' competencies in applying evidence-based medicine.
Good morning. Agree, it is a crucial aspect of their education. We want our graduates to be proficient in integrating research evidence with clinical expertise and patient values. I have come across a framework called CREATE, the classification rubric for evidence-based medicine assessment tools in education. It suggests 7 categories for assessing the outcomes of evidence-based medicine education.
Interesting. What are these categories?
Well, it covers learners' reactions, attitudes, self-efficacy, knowledge, skills, behavior, and benefits to the patient. Each category plays a role in evaluating the impact of evidence-based medicine education.
That sounds comprehensive. But how do we assess these aspects effectively?
The CREATE framework recommends using various tools. Learners' reactions, attitudes, and self-efficacy can be best assessed through self-report, while the knowledge and skills are best examined through performance assessments. And for the behavior and benefits to patients can be monitored actively and measured through patient-oriented outcomes.
It makes sense to assess each aspect in a tailored manner. What tools are available for knowledge and skills assessment?
The Fresno test and the Berlin questionnaire are 2 prominent tools designed to assess EBM knowledge and skills objectively. The Fresno test involves 12 open-ended questions based on clinical scenarios, while the Berlin questionnaire is 15 scenario-based multiple-choice test.
Are there other assessment methods?
Absolutely. Multiple-choice questions, essays, and objective-structured clinical examination can examine learner competency to some extent. Tools like objective assessment of surgical and technical skills and direct observation of procedural skills can assess trainees' knowledge of research evidence for procedures and their ability to integrate it into practice.
Interesting. What about real-life scenarios?
Case-based discussions and mini-clinical examinations allow trainees to demonstrate their knowledge, awareness, and application of evidence in managing patients. Multi-source feedback, such as 360-degree assessments, can provide a holistic view by incorporating peer assessments and feedback from clinical librarians and audit departments.
It seems like there are various tools available. How do we choose the right ones?
It depends on our specific goals and the competencies we want to assess. We need a mix of tools that can cover different aspects of evidence-based medicine competencies effectively.
Thank you for the insights. I'll look into these tools and see how we can implement them in our curriculum.
You're welcome. Let me know if you need any assistance. It's crucial for our students to develop strong EBM competencies.